foods that can destroy your kidneys, and some may surprise you. At the end of the video, you can find some helpful diet tips to boost your kidney health. Before we dive in, kindly note that all information you'll find in this video is fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the foods that can destroy your kidneys. 18. Banana. Bananas are well known to help with weight loss, support heart health, provide natural energy, and regulate your digestive system. However, this superfood is also a rich source of potassium. See, a healthy kidney balances potassium levels in the blood. However, people with chronic kidney disease, or CKD in short, or kidney damage for at least 3 months should limit their intake. To give you an idea, the National Kidney Foundation in the U.S. recommends a daily intake of 2,000 mg of potassium for people with CKD. A medium-sized banana has around 422 milligrams of potassium, and many people eat more than one at a time. So if you enjoy bananas but have kidney disease, try mixing them into smoothies or juices with low potassium fruits like apples and berries to reduce your potassium intake. 17. Avocados. Avocados are full of healthy fats and antioxidants. However, these creamy fruits are loaded with potassium, just like bananas. This is concerning for kidney patients, as guidelines for kidney disease often suggest limiting potassium to less than 2,000 mg a day. To put it simply, a 100-gram serving or half of a medium-sized avocado contains 485 milligrams of potassium. More concerning, despite being full of nutrients, avocados are also calorie-dense. One fruit can contain over 300 calories. So, consuming too many avocados can contribute to weight gain, a common risk factor for kidney disease. So, it's best to limit avocado when you're watching your potassium intake for your kidneys' sake. 16. Apricots. Apricots, which are rich in potassium, are generally avoided in the later stages of kidney disease. One apricot contains 90.6 milligrams of potassium. For kidney patients, regularly eating potassium-rich foods like apricots can raise blood potassium levels. This can lead to weakness, numbness, fatigue, and nausea. In severe cases, high blood potassium levels can even cause irregular heartbeats or cardiac arrest. So, it's smart to consume apricots in consultation with a dietitian. Besides apricots, peaches and plums contain significant amounts of potassium. So if you have kidney conditions, exercise caution with these fruits, especially in their dried form. 15. Oranges or orange juice. Oranges and orange juice are not only nutrient-dense, but also rich in potassium. When it comes to oranges, one whole orange contains around 255 milligrams of potassium, while 1 cup of chilled orange juice, made from concentrate, contains 443 milligrams of potassium. This amount may not seem significant, but eating more than 1 orange a day or drinking orange juice can easily exceed your daily potassium limit. So, for people with kidney disease, be mindful of your orange intake. 14. Tomatoes and tomato sauce. Tomatoes are an excellent source of fiber, vitamins, minerals, and antioxidants to fight cancer. However, kidney patients should know that tomatoes have a high potassium content. Just 100 grams of ripe tomatoes can contain up to 237 milligrams of potassium. And tomato products such as sauce, gravy, and ketchup have for people with kidney disease. Their tomato consumption depends upon the stage of kidney damage. To find out what's right for you, consult a registered dietitian or a qualified health professional. 13. Pretzels and crackers. Popular snacks like pretzels offer little, if any, nutritional value while being high in added sodium or salt. It's normal for anyone to exceed their daily allowance value for sodium intake while snacking. According to the National Kidney Foundation, a healthy diet should contain less than 300 milligrams or 2.3 grams of sodium daily, equal to half a teaspoon. High sodium intake will increase blood pressure, which may result in kidney stones and kidney damage in the long run. So checking the snack labels to avoid excess salt in your diet is always wise. 12. Canned and frozen foods. Canned foods such as soups, vegetables, meats, and seafood are popular because they are convenient and easy to prepare. However, the canning technology requires salt as a preservative to extend the shelf life. Hence, it results in high sodium content that harms your kidneys. Keep in mind that frozen items like vegetables or fish often have extra sodium added. Even a single huge serving of these easy-to-use products can surpass your daily sodium limit of 2.3 grams. If these heavily processed foods are staples in your family now, consider switching to fresh options. 11. Processed meat. Any meat such as flesh, fat, muscle, or offal can be cured, processed, smoked, or fermented to improve flavor and extend shelf life. Most processed meats, such as hot dogs, sausages, beef jerky, corned beef, and pepperoni can be high in sodium and phosphorus. The exact amount depends on their additives and processing methods. The problem is that excess salt and phosphorus intake can seriously harm your kidneys. The National Kidney Foundation recommends eating no more than 700 milligrams of phosphorus a day for normal kidney function. Moreover, processed meats are linked to cancer and other chronic diseases, so it's best to avoid them all. 10. Soda. Phosphorus additives to increase flavor and shelf life. Compared to natural sources, phosphorus from sodas is absorbed to a greater extent. Besides phosphorus, sodas are also a rich source of calories and sugar. If you have diabetes, too much sugar can cause kidney damage. This is because high blood sugar from diabetes can damage tiny filters and blood vessels inside the kidneys. Moreover, drinking sugary liquids, such as soda, is worse for you than consuming sugar in solid form. Many people opt for diet soda, assuming it has less sugar. However, diet soda still contains harmful additives and artificial sweeteners that can harm your kidneys. So, it's best to cut back on your soda intake. 9. Pickles and relish. Fermentation is a traditional method to extend the shelf life of fruits and vegetables. This method also enhances flavor and promotes the growth of probiotic bacteria for a healthy gut. However, fermented foods, such as pickles and relish, are high in sodium. For example, one large pickle contains 1,630 milligrams of sodium. This amount is more than half the recommended value for a kidney patient. Similarly, kimchi, a popular fermented food, contains 747 milligrams of sodium per cup. Therefore, practicing moderation with fermented foods is important if you're worried about your kidney health. 8. Potatoes and sweet potato. Regular and sweet potatoes are rich in essential amino acids, vitamins, and minerals, making them a superfood. But potatoes are also full of energy and potassium. For instance, one cooked potato contains about 610 milligrams of potassium, and a medium-sized cooked sweet potato can have 542 milligrams. The good news is, you can lower their potassium content by soaking them in water before cooking. Give it a try next time you cook. Note that common potato snacks like French fries or chips are loaded with fat, sodium, and salt, which can strain your kidneys while offering little, if any, nutrition. So, steer clear of them for the sake of your kidneys. 7. Dried fruits. Drinking enough water is significant for kidney function. Dried fruits lose water during dehydration, so they don't make you feel as full as fresh fruits. Dried fruits are also small and easy to snack on, so you might overeat without realizing it. This can lead to more calories, potassium, and sugar intake, which isn't good for your kidneys. For example, 1 cup of pitted, uncooked prunes has 1,270 milligrams of potassium, meeting half your daily requirement. Moreover, some dried fruits contain added additives, salt, and sugar to enhance flavor. So, consuming dried fruits every day may overwork your kidneys. If you want to protect your kidneys, stick with fresh fruits as a snack. 6. Whole grains. In general, grains are composed of 3 layers. Whole grains contain the outermost part, or bran, a rich source of phosphorus and potassium. A cup of brown rice can contain around 208 milligrams and 174 milligrams of phosphorus and potassium, respectively. In contrast, a cup of white rice carries about 69 milligrams of phosphorus. This means white rice contains only about 1/3 the amount of phosphorus and potassium found in brown rice. So, if you have moderate to severe kidney disease, choosing refined grains might be better than whole wheat bread, bran cereals, and brown rice. 5. Nuts. Nuts are rich in protein, healthy fats, and oils. However, the amount of potassium and phosphorus in nuts may harm people suffering from kidney disease. Let's take almonds, for example. A 1-ounce serving, which is about 23 almonds, provides 136 milligrams of phosphorus and 208 milligrams of potassium. Similarly, cashews contain 168 milligrams of phosphorus and 187 milligrams of potassium per ounce, which is around 16 to 18 cashews. So, even healthy snacks like nuts need to be consumed in moderation if you have kidney health concerns. 4. Legumes. Legumes, including beans and lentils, are great sources of plant-based protein, fiber, vitamins, and various minerals. However, this superfood needs to be eaten with caution for people with kidney concerns. Legumes are high in potassium and phosphorus. For example, 1 cup of boiled or cooked pinto beans contains 251 milligrams of phosphorus, which is 746 milligrams of potassium. When your kidney function declines, phosphorus and potassium can build up in your body, causing damage to your bones, blood vessels, and other organs. If you have kidney concerns, be cautious when consuming legumes and cook them thoroughly to reduce potential side effects. 3. Dairy. Dairy products such as cheese, milk, and ice creams are excellent sources of protein, calcium, and vitamin D. Dairy, however, they are also rich in phosphorus and potassium. For example, 1 cup of milk with 2% milk fat can contain 252 milligrams of phosphorus and 390 milligrams of potassium. This amount is too much for unhealthy kidneys. Some dairy products also contain saturated fats, which can stress your kidneys more. So, although dairy is okay in moderation, especially in a balanced diet, it's wise to limit it if you have kidney issues. 2. Spinach. Spinach is rich in phytochemicals, vitamins, and minerals, especially potassium. Just 100 grams of uncooked spinach can have as much as 558 milligrams of potassium, and cooking does not affect the potassium content in spinach. Moreover, spinach is high in oxalate, a known kidney killer. Even if you only have a little oxalate every day, it can build up in your body and lead to kidney stones and damage. Other foods like cassava root, chard, and rhubarb also have high oxalate levels, so it's better to avoid them for your kidney health. Instead, go for low oxalate options like kale, carrots, zucchini, lettuce, cabbage, broccoli, and cauliflower. Large amounts of alcohol consumption are strongly associated with kidney malfunction. Due to the toxicity of alcohol, it can cause inflammation and impede kidney function, contributing to toxic burdens in the body. Alcohol may also increase the risk of low blood sugar and dehydration, which are bad for your kidneys. If you want to keep your kidneys healthy, it's important to cut back on alcohol and drink enough water. Your healthcare provider can assist you in deciding how much and how often it's safe for you to drink based on your conditions. And there you have it, folks, our list of 18 worst foods that can destroy your kidneys. In short, to keep your kidneys healthy, steer clear of foods high in oxalate, sodium, potassium, and phosphorus, as well as processed foods. Now, we will share some more tips on how to create a good diet for your kidneys. First, try to maintain a sufficient protein meal throughout the day. High-protein foods include meat, fish, poultry, fresh pork, and eggs. Another helpful tip is to drink coffee, tea, green tea, water, or any other drinks at room temperature. Staying hydrated will also help you take better care of your kidneys. When shopping, read labels to check for oxalate, sodium, potassium, and phosphorus content in foods. Here is a simple tip. Processed and packed foods are generally less healthy for your kidneys. Cooking at home gives you more control. You can add flavor to your meals with herbs or spices instead of unhealthy additives or sugar. Plus, cooking at home lets you manage your salt intake better. The most important thing is that all foods have good and bad elements. So moderation and variety are always the keys to your kidney health. Our list of 18 foods that can destroy your kidneys should be carefully considered based on your individual needs and condition. It's best to develop a personalized diet plan with the guidance of a qualified healthcare professional or dietitian. In the end, remember that your daily limits are oxalate, sodium, potassium, and phosphorus. Now, we want to send a big thank you to all our current subscribers and supporters. Your support inspires us to continue sharing top-notch health tips and information with you. On our channel, you'll find many other helpful videos about eating tips to boost your health naturally and insights into diseases. To explore more interesting food lists, check out the playlist on the screen. You'll discover smart food choices for your brain, heart, and other organs. We'll also give you tips on how to enjoy these foods to the maximum benefit. Stay informed. Stay healthy. 9 skin signs that may indicate your kidneys are damaged. It is important to know that skin changes usually appear when you've already been having problems with your kidneys for a while. Remember, early detection and treatment can make a world of difference in kidney health. According to the latest studies, more than 800 million people worldwide may experience chronic kidney disease. So, if you have any risk factors, such as high blood pressure, diabetes, or obesity, or if you suspect kidney problems, check for these skin signs and discover helpful tips for keeping your skin healthy. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Skin signs of kidney disease. Some skin changes are specific to kidney disease, whereas other changes in the skin are non-specific and may be associated with a variety of medical problems. 1. Itchy skin or pruritus. This is one of the most common skin symptoms in people with kidney damage, occurring in as many as 40% of people with end-stage renal disease, or ESRD for short. But what causes this itchiness? When the kidneys cannot effectively filter out waste products, urea accumulates in the blood. This buildup can lead to uremic pruritus, the medical term for itching caused by kidney disease. Itchy skin can occur anywhere on the body, but it commonly affects the back, legs, and arms. It is intensified by sweat, dry skin, and heat. While it may sound mild, this itchiness can be so intense and persistent that it can lead to a poor quality of life. When the pruritus is severe, the urgent need to scratch leads to more severe skin problems. Scratching may cause scrapes, or excoriations, on the skin, thicken, leathery skin, or skin lichenification, or raised bumps, or prurigo nodularis. Ongoing scratching can cause lesions to bleed. And a compromised skin barrier becomes an easy way for bacteria to enter and lead to more severe infections. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 2. Rashes. Rashes are also a common skin sign in people with kidney damage caused by poor elimination of toxins that build up in the skin. Acquired perforating dermatosis is a type of rash that appears in individuals with end-stage kidney damage. In the form of small, pigmented, itchy bumps with a scaling center. These bumps can usually be found on arms and legs. Less commonly, they may be found on the trunk, scalp, and buttocks. As the bumps heal, new ones can appear, creating lesions in multiple stages of healing, which may join together to form larger patches. Although these rashes are often itchy, you should avoid scratching because it can lead to worsened skin conditions. 3. Blisters. Blisters may also occur in people with kidney damage. They often appear as fluid-filled sacs on exposed areas, such as the backs of the hands, forearms, or, less often, on the feet and the face. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. Blisters associated with kidney damage can vary in size and severity. They may be accompanied by other symptoms such as pain, redness, and swelling. Unfortunately, when blisters heal, they dry up and develop a crust that later peels away, usually leaving a scar and skin discoloration. 4. Calcium deposits. Calciphylaxis is one of the most severe skin conditions associated with kidney damage. It occurs when calcium accumulates in small blood vessels, leading to painful sores and ulcers. It's a rare but serious condition that occurs in up to 4% of patients undergoing dialysis and requires immediate medical attention. The exact cause of calciphylaxis remains unclear, but several factors can increase the risk. High blood calcium levels. This often happens due to imbalances in calcium and phosphate. 2. Dialysis. Long-term dialysis patients are more at risk. 3. Obesity. Higher body mass index, or BMI, can be a contributing factor. 4. Medications. Certain medications can impact calcium metabolism. Patients with calciphylaxis describe painful pink or purple bumps or plaques that develop into deep, painful ulcers covered with black crusts, usually located on the abdomen, buttocks, and legs. Another type of calcium accumulation is represented by calcinosis cutis, which refers to calcium deposits under the skin. Calcium. These are usually firm white nodules near joints that may break through the skin and release a white chalky discharge. Calcinosis cutis are usually not painful unless they are located in the fingers or toes. 5. Dry skin xerosis. Dry skin or xerosis is one of the most common skin signs of kidney damage. However, dry skin is nonspecific as it can be caused by a number of conditions besides kidney damage. Dry skin occurs in 50–80% of individuals on dialysis. And here are a few common causes. 1. Poor hydration. Decreased sweat gland activity. 3. High levels of vitamin A. And 4. Long-term use of diuretics. Xerosis usually occurs in those who have been dealing with kidney damage for a while and are on dialysis, which often causes skin to become dry, rough, and scaly. People with xerosis also experience tight skin that can easily crack, leading to exposed entryways for bacteria. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Swelling. The kidneys have many functions. One of the most important ones being the elimination of excess water and salt from our bodies. If your kidneys are damaged, water and salt may not be eliminated properly, leading to a buildup of fluid. This water and salt retention causes swelling and puffiness, especially in the hands, feet, and face. 6. Swelling. If your legs feel puffier than usual, press them with your finger to see if it leaves an indentation, called pitting edema. If you experience swelling and puffiness, you should see your healthcare provider to have your kidney function evaluated. 7. Changes in skin color. The presence of kidney damage can lead to a buildup of waste products in your bloodstream, which may cause your skin to change color, often with gray or yellow hue. This discoloration results from the toxins that are not being filtered and excreted in the urine. Skin hyperpigmentation may also occur as a result of a buildup of melanin, and it may be seen as a dark brown color. Skin pallor, or paleness, is commonly observed in individuals with chronic kidney disease caused by anemia. Another skin discoloration related to kidney damage is uremic frost, a white, powdery substance left on the skin's surface after sweat dries. Excessive scratching may also change the color or texture of your skin. 8. Nail disorders. Many medical conditions can cause nail changes, including kidney disorders. In a study of 100 patients, nail changes were found in 60% of individuals with CKD. In another study of 101 patients with severe renal disease who were on dialysis, 8. Nail disorders. Hair, mucosal, and nail disorders were found in 23–45% of the patients. On your finger or toenails, you may notice one white transverse band, called Mees line, or multiple bands, called Morch's lines. These can appear in people with kidney damage due to stress or low protein levels in their blood. Another frequent finding is the half and half nail disorder, also known as Lindsay nails, characterized by a brownish color at the top of the nails from increased melanin and a white or pink color at the bottom of the nails due to an increased number of small blood vessels. Less common changes are splinter hemorrhages, which are small, red or brown lines under the nails that resemble splinters. They can be a sign of underlying health issues including kidney damage, and they are caused by small blood clots that damage the capillaries under the nails. Keeping nails trimmed and moisturized can reduce the risk of nail disorders. 9. Hair disorders. One of the most troubling symptoms for individuals with kidney damage is hair loss. This condition, medically known as alopecia, can have an impact on self-esteem and quality of life. Hair loss can result from several factors associated with kidney disease. 1. Nutritional deficiencies. Kidney damage often leads to imbalances in essential vitamins and minerals, such as iron and zinc, which are critical for healthy hair growth. 2. Hormonal imbalances. The kidneys regulate many different hormones that affect hair growth. When the kidneys are not working properly, it can lead to hormone dysregulations, which can affect hair growth cycles. 3. Medications. Some of the medications prescribed for kidney disease, including certain blood pressure medications and immunosuppressants, can contribute to hair thinning and loss. Dehydration and dialysis treatment can strip hair of natural oils, making it more dry and brittle. It is important to remember that hair loss and hair shedding can occur from a variety of medical conditions. If you are experiencing a sudden increase in hair shedding or patches of alopecia, see your healthcare professional to help determine the cause. What can you do? We covered many skin signs, some more severe that would make us call our doctor, and other more common ones that may not necessarily be related to kidney damage. So, the question that follows is, when to seek medical help, and who to consult for these symptoms. As this video shows, some skin symptoms are more specific or serious, and clearly require a visit to a healthcare provider. But what do we do about those less alarming symptoms that we might ignore or confuse with other causes? Kidney damage affects many people, but there are some risk factors for kidney disease that you should consider when you notice skin changes. If you are over 60 with other conditions such as high blood pressure, diabetes, or obesity, pay close attention to your skin and nail changes, even seemingly ordinary ones. You should contact your primary care doctor at any sign of skin changes. For more information, visit www.fema.gov. Blood and urine tests will help diagnose kidney problems, allowing you to start proper treatment recommended by a nephrologist or kidney doctor. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. If you have severe or persistent skin symptoms, you should see a dermatologist or skin doctor who can collaborate with your nephrologist. How can I manage these symptoms by myself? After being diagnosed, you should initiate proper treatment, but you should not rely only on medication. Our lifestyle and day-to-day practices play a key role in the healing process. You need to make important changes to manage kidney damage. These changes include diet and nutrition. Eating a balanced, kidney-friendly diet is important for your skin health. Monitor your salt, protein, phosphate, and calcium intake. Quit smoking and limit or avoid alcohol consumption. Search for new recipes or talk to a nutritionist who can recommend dishes based on your favorite flavors. 2. Hydration. Drinking enough water can help keep your skin hydrated and reduce dryness. However, if you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Consult your healthcare provider to determine your ideal water intake. 3. Moisturizing. To combat dryness and itchiness, moisturize your skin at least once a day. Use fragrance-free hypoallergenic moisturizers to avoid irritation. Emollients that contain salicylic acid or urea and a gentle skincare regimen can be useful. 4. Avoiding hot showers and baths. Hot showers can strip your skin of its natural oils, making it dry and itchy. Avoid long baths and try taking short showers with lukewarm water. 5. Avoiding harsh skincare products. Avoid using harsh soaps and skincare products that can irritate your skin. Stick to gentle, fragrance-free products designed for sensitive skin. 6. Sun protection. Sun damage can worsen skin problems, especially if your skin is sensitive. Use sunscreen with at least SPF 30 to protect your skin, even on cloudy days, and reapply it throughout the day. 7. Comfortable clothing. Wear loose-fitting, comfortable clothing made from natural fibers like cotton. This can help prevent irritation and allow your skin to breathe. 8. Regular checkups. Regular checkups are essential for monitoring your kidney function and overall health. Discuss any new symptoms or concerns with your doctor during these visits. What is the most important takeaway from this video? When it comes to kidney health, recognizing skin signs is crucial for early diagnosis and effective management. Kidney damage often causes specific symptoms like itchy skin, rashes, blisters, and calcium buildup in vessels and skin. It can also lead to nonspecific signs such as dry skin, swelling, changes in skin color, nail and hair disorders. Each of these symptoms signals potential underlying renal problems. For more information, visit www.fema.gov. Itchy skin, for example, affects 90% of people on hemodialysis due to the buildup of waste products like urea. Similarly, rashes, blisters, and calcium deposits signal that the kidneys struggle to eliminate toxins effectively. Although less specific, nail and hair disorders should not be ignored, especially in those with associated risk factors, as they can signal deteriorating kidney function. People with kidney disease should watch for these symptoms, especially if they are at high risk, due to factors like age over 60, diabetes, high blood pressure, or obesity. Early detection can significantly improve treatment outcomes. Seek immediate medical help when these signs appear. Blood and urine tests will confirm the diagnosis and pave the way for proper treatment, often involving collaboration between a nephrologist and dermatologist. Managing these symptoms involves more than just medical treatment. Lifestyle changes play a crucial role. These include maintaining a balanced diet, staying hydrated without excess, using gentle skincare products, avoiding hot showers and harsh soaps, and ensuring proper sun protection. Such changes can greatly improve your quality of life and skin health. In conclusion, recognizing and addressing skin signs linked to kidney damage on time helps diagnosis and management of the condition. Adopting a proactive approach helps manage the symptoms and improves overall kidney health and quality of life. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. Check out the video on the screen for the top 5 fruits that can help cleanse your kidneys. We also offer tips to get the most from them. See you there. Stay informed. Stay healthy. Avoid these 7 plant-based foods that can damage your kidneys. In recent years, many experts have suggested the benefits of a plant-based diet and reducing the strain on your kidneys. But just because something is from a plant doesn't mean it's good for your kidneys, particularly if you have kidney disease. In reality, some plant-based foods can actually pose risks, and cutting back on them would bring lasting rewards. Watch this video to learn 7 plant-based foods you should avoid to protect your kidneys. Before we dive in, please note all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 7. Seed oils. Seed oils are plant-based cooking oils obtained from seeds. Examples are rice bran, canola, corn, cottonseed, grapeseed, soybean, sunflower, safflower, and peanut oils. These oils are promoted as valuable lipid sources due to their healthy fatty acid content and bioactive compounds. However, these oils have undergone extensive processing, including bleaching, refining, and heating, to extract and clean them before they can be used for cooking and baking. Refining can strip away essential nutrients like antioxidants and sometimes produce unwanted compounds. One example is trans fatty acids, one of the most harmful compounds for your kidneys and overall health. More concerning, seed oils can contribute to inflammation in the body due to their high omega-6 fatty acid content. Inflammation is the root cause behind a long list of health conditions like kidney disease, arthritis, heart disease, and diabetes. Small amounts of omega-6 fatty acids are necessary for your overall health. However, excessive consumption, typical in Western diets, can disrupt the balance between omega-6 and omega-3 fatty acids, leading to health problems such as kidney damage. Fats are divided into saturated and unsaturated types. Unsaturated fats found in oils like olive oil are healthier, offering benefits such as improved cholesterol and heart health. Saturated fats found in animal products and some plants like coconut should be limited. Replacing saturated fats with unsaturated ones can minimize the harm caused by seed oils. Opt for unrefined oils, such as extra virgin olive oil, which retain more natural nutrients, flavor, and aroma. Because they are extracted using methods like cold pressing without high heat or chemicals, unrefined oils are tastier, healthier, more natural, and free from harmful additives. This purity and nutrient retention support overall health, including kidney function. 6. Canned vegetables and canned soups. Canned soups and vegetables are commonly consumed because of their low cost and convenience. However, these foods typically contain high levels of sodium for preservation, which can be problematic for those with kidney disease. When the kidneys are not functioning properly, they cannot effectively filter out excess sodium from the blood. This leads to a buildup of sodium, which can increase blood pressure and put additional strain on the kidneys. It is worth emphasizing that canned foods often contain added sugars or chemical additives. This is why individuals with kidney disease should avoid or limit canned foods, including canned vegetables. Instead, look for fresh or low-sodium alternatives. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Chips and pretzels. Baked chips, despite their reputation as a healthier alternative to the fried version, can still pose risks to kidney health. Baked chips are highly processed and low in fat, making it easy to overeat without feeling full. Pretzels are processed baked bread snacks, which can raise blood sugar levels and promote fat storage. These effects can contribute to kidney damage over time. Potato chips and pretzels are also low in essential nutrients like fiber and protein, and can contribute to weight gain and obesity, potentially damaging your kidneys over time. Worse still, both chips and pretzels can contribute to high sodium intake, which can strain the kidneys by causing fluid retention and elevated blood pressure. High salt intake may worsen already existing kidney damage and increase the risk of cardiovascular complications like heart attacks and strokes. Try to moderate your intake of these foods in favor of healthier snack options to support kidney health. 4. Ketchup. Ketchup is made from tomatoes, which are high in potassium, and excessive potassium intake can be problematic for those with poor kidney function. Also, ketchup is often high in added sugar and sodium, which can contribute to high blood pressure and strain on the kidneys. 1 tablespoon, which is 17 grams, can contain 180 milligrams of sodium and 4 grams, which is equivalent to 1 teaspoon of sugar. It's best to choose options that are low in these ingredients, especially those that don't include high fructose corn syrup. The sugar in ketchup, like high fructose corn syrup, can lead to obesity and insulin resistance, making kidney function worse. Ketchup also has lots of phosphorus, which isn't good for individuals with kidney issues. Too much phosphorus can cause problems since damaged kidneys struggle to filter it out. It's important to avoid other store-bought condiments that might cause similar adverse effects. This includes salad dressing, barbecue sauce, and soy sauce, as they often contain high levels of sodium, sugars, or chemical additives. Rather than topping your favorite summer dishes with these condiments, consider using salsa. Choose fresh, salt-free salsa from the store, or make your own at home. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Instant noodles. Instant noodles are pre-cooked, dried noodles that are popular worldwide due to their convenience, long shelf life, variety of flavors, and reasonable cost. However, they are often criticized for being unhealthy due to their high sodium, carbohydrate, and trans fat content, and lack of essential nutrients like fiber, vitamins, and minerals. In 2017, Nutrition Research and Practice published a study involving 397 college students in Seoul, aged 18 to 29. The study aimed to understand how eating instant noodles affects heart and metabolic health. They found frequent instant noodle intake was linked to elevated levels of blood triglycerides and sugars and increased blood pressure. These effects can potentially cause diseases that lead to kidney damage. Instant noodles are a perfect example of ultra-processed foods, or UPFs for short, which can damage kidney function. UPFs are typically high in calories, refined carbohydrates, sugar, salt, chemical additives, and trans fats, and low in dietary fiber and essential nutrients. A 2022 study published in the American Journal of Kidney Diseases analyzed data from the Atherosclerosis Risk and Communities Study, a major research initiative conducted in the United States. This study involved 679 middle-aged adults without kidney disease at baseline. After analyzing, the researchers found that each additional serving of ultra-processed foods, including canned soup, was linked to a 5% higher risk of chronic kidney disease, or CKD for short. These findings highlight the potential harm of canned soup and other ultra-processed foods on kidney health. A study conducted in Korea found that people consuming the most UPFs had a higher prevalence of CKD. The results demonstrated that every 6% increase in UPF consumption was linked with a 6% higher prevalence of CKD. This association may be due to the harmful ingredients found in UPFs, such as hydrogenated oils and chemical additives, which can cause oxidative stress and inflammation. Frequent consumption of instant noodles can harm the kidneys due to their high phosphorus content, which can raise serum phosphorus levels. Elevated serum phosphorus is linked to increased mortality and cardiovascular events. Efforts are being made to address these concerns and develop healthier versions. In Malaysia, for example, researchers have explored the use of composite flours, incorporating locally available ingredients like seaweed powder to improve the nutritional value and quality of instant noodles, while reducing dependence on imported wheat flour. 2. Frozen meals. Pre-packaged vegan-vegetarian frozen meals frequently contain lots of salt, potassium, and phosphorus, which can be bad for patients with kidney disease. Excess salt and other preservatives are often added to make these meals taste better and last longer. Moreover, excessive potassium intake can be problematic for individuals with compromised kidney function, as mentioned earlier, because the kidneys struggle to properly regulate potassium levels in the blood. However, plant-based diets in kidney disease have been shown to be beneficial, as the potassium in fresh whole plants are paired with fiber, which prevents its absorption. Talk with your dietitian about the right plant-based diet for you. Similarly, additives containing phosphorus in processed frozen foods can contribute to elevated phosphorus levels in the blood, potentially leading to bone and heart complications in those with kidney disease. Therefore, frozen meals are generally not a good choice for people concerned about kidney health, especially if consumed regularly. To make frozen meals less harmful to kidney health, choose those with lower sodium and reduced potassium and phosphorus content. This involves carefully reading labels and selecting products with minimal processed ingredients. A better option is to prepare homemade meals using fresh whole food ingredients, allowing for greater control over nutrient intake. Try cooking large batches of kidney-friendly vegetarian or vegan dishes and freezing individual portions for later consumption. By prioritizing fresh, whole foods and mindful meal planning, you can enjoy a kidney-friendly diet while minimizing potential harm. 1. Chocolate bars or energy bars. While cocoa contains phenolic antioxidants and flavonoids that can help support the function of your blood vessels, chocolate bars should be consumed with caution. Chocolate bars have high levels of saturated fats and added sugar. These components contribute to high blood sugar, high blood pressure, and weight gain, which are common triggers for kidney disease. Chocolate bars and energy bars are also considered UPFs, which are linked with an increased risk of CKD and worsen complications in patients with CKD. As mentioned earlier, UPFs are typically high in energy, low in nutritional value, and contain additives that may be harmful to kidney health. Energy bars, often consumed for replenishing electrolytes lost during exercise, can pose significant dangers to kidney health. Similar to energy drinks, they often contain high amounts of sugar to provide a quick energy boost. Also, the combination of high sugar and other additives in energy bars leads to conditions that can cumulatively strain the kidneys. Thus, long-term consumption of energy bars can accelerate kidney damage. Therefore, it is essential to minimize your consumption of these processed bars and consider fresh fruits and other healthier alternatives. Are your kidneys damaged? Healthy kidneys filter about half a cup of blood each minute, getting rid of waste and excess water to produce urine. The urine travels from the kidneys to the bladder through two thin muscular tubes called ureters. One on each side of the bladder. The bladder serves as a reservoir, temporarily storing the urine. Together, the kidneys, ureters, and bladder make up the urinary system. When your kidneys are damaged, waste and fluid build up. Over time, this can lead to kidney disease and kidney failure, which can be either acute or chronic. Acute kidney failure is usually short-term and reversible, while chronic kidney failure is a long-term condition that is progressive. Symptoms of kidney damage can include nausea, vomiting, fatigue, sleep problems, changes in urination, decreased mental sharpness, muscle cramps, swelling of feet and ankles, itchy skin, and high blood pressure. These signs might not manifest until irreversible damage has occurred due to the kidney's ability to compensate for lost function. Kidney problems can cause anemia and bone and mineral disorders, such as hyperkalemia, which can be deadly. Additionally, kidney failure can heighten the risk of heart disease or stroke. Without treatment, kidney failure is fatal. Doctors rely on biomarkers like creatinine levels, glomerular filtration rate, or GFR, and protein in the urine to assess kidney function. Newer biomarkers such as kidney injury molecule and neutrophil gelatinous-associated lipocolin show promise for early detection of kidney damage. Triggers for kidney disease include high blood pressure, high blood sugar, and high blood cholesterol levels. The increased force from high blood pressure injures the filtering units of the kidneys. Elevated blood sugar from diabetes can cause damage to small blood vessels in the kidneys, which harms the filters. Additionally, cholesterol forms plaques along the artery walls, blocking blood flow to the kidneys, which impairs their function and also causes protein loss in the urine. Other diseases and environmental factors can also contribute to kidney damage. Obesity increases the risk of chronic kidney disease, or CKD, by lowering urine pH, causing chronic inflammation, and disrupting fat metabolism. It also worsens high blood pressure, insulin resistance, and glucose intolerance, further raising the CKD risk. While CKD can be caused by various factors, including diabetes and high blood pressure, dietary choices play a significant role. This video has highlighted some plant-based foods to avoid, emphasizing the importance of opting for less processed alternatives. The one thing all of these foods have in common is that they are processed. From seed oils to flavored instant oatmeal, many processed foods contain additives that can worsen kidney disease. To maintain healthy kidneys, swap out high-sodium condiments like ketchup for homemade sauces with fresh herbs. Opt for antioxidant-rich fruits and vegetables. Choose lean proteins with less saturated fat, and stay hydrated with water. By prioritizing whole, nutrient-rich foods and limiting processed options, you can support your kidneys and prevent pre-existing kidney conditions from getting worse. Remember, consulting with a healthcare professional is necessary. Especially if you have an existing kidney condition, your doctor and registered dietitian can provide personalized guidance to help you make informed dietary choices and maintain optimal kidney health. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. Check out the video on the screen for the top 5 fruits that can help cleanse your kidneys. We also offer tips to get the most from them. See you there. Stay informed. Stay healthy. High creatinine level indicates kidney disease, and keeping it low can help you avoid the pain and costly treatments associated with advanced kidney issues, such as dialysis. Try these 7 simple habits to lower your creatinine level and maintain healthy kidneys. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 7. Avoid over-the-counter anti-inflammatories. People with pain, cold, flu, and fever symptoms often take over-the-counter, or OTC for short, non-steroidal anti-inflammatory drugs, or NSAIDs for short, which include ibuprofen, or Advil, Motrin, naproxen, and aspirin. Medications containing NSAIDs can be damaging to people with kidney disease. In other words, when the kidneys aren't functioning properly, they may rely on chemicals called prostaglandins to help keep the blood vessels open and improve blood flow. One of the results of NSAIDs is the blocking of the production of prostaglandins in the kidney, thereby preventing the needed vasodilation and necessary blood flow. A 2021 study published in the journal Healthcare in Basel examined how 18 months of low-dose aspirin use affected patients with severe kidney disease who were not on dialysis. Out of 12,000 patients, the 3,000 who took aspirin had a 15% higher risk of starting dialysis. Low-dose aspirin is often prescribed to prevent cardiovascular disease in patients with kidney disease, but it may also worsen outcomes for those with severe kidney disease. Furthermore, having caffeine along with NSAIDs may increase the risk of kidney damage. Caffeine raises blood pressure, causes renal vasoconstriction, and increases urination and dehydration. If you do take NSAIDs, make sure to drink plenty of water, or even better, avoid them if you have chronic kidney disease, or CKD for short. If you have CKD, you may be wondering what medications are safe to use to treat your pain. In early kidney disease stages, taking NSAIDs for a few days may be low risk. However, your kidney specialist should supervise your longer-term treatment. Taking NSAIDs at higher doses increases the risk of electrolyte imbalances, high blood pressure, and worsening kidney damage in people with advanced kidney disease. NSAIDs treatment should be personalized based on the severity of your kidney disease, overall health, the medications you are taking, and your age. Ask your doctor for advice about taking OTC NSAIDs to learn about their safety and any alternatives you may use. Before taking OTC medications, check each product's label for its contents or warnings. 6. Eat more fiber. Increasing fiber in your diet may significantly prevent chronic diseases that cause kidney damage. One of fiber's many benefits includes lowering the amount of creatinine in the body. That's because consuming dietary fiber helps feed gut bacteria that help break down creatinine and reduce inflammation. Fiber also helps prevent constipation and balance cholesterol, blood sugar, and blood pressure. A 2022 meta-analysis published in the journal Nature reviewed the impact of fiber intake on kidney damage, showing mixed results. The variability may lie in the difficulty of studying individual nutrients. One study of over 3,500 patients showed no effect of dietary fiber intake on creatinine levels. However, another study showed fiber's positive impact on disease prevention and inflammation reduction, which also helps decrease the rates of kidney disease. Another study found that individuals with kidney disease who reduce their consumption of a Western diet while adopting a plant-based diet have higher survival rates. The Dietary Guidelines for Americans, or DGA, recommend that most adults consume 28 grams of fiber daily. Fiber is present in all plant food sources, including fruits, vegetables, whole grains, and legumes such as beans, chickpeas, and lentils. Adults should eat 3 to 5 ounces of whole grains daily and 1 to 3 cups of legumes weekly. In addition, they should include 1/12 to 2/12 cups of fruit and 2 to 4 cups of vegetables in their diet daily. A dietitian can provide appropriate recommendations for people who must watch their blood potassium levels, such as patients on dialysis. Examples of foods that contain lower potassium and higher fiber include different food categories, including legumes, vegetables, such as cooked broccoli, cabbage, radishes, beets, and cauliflower, and specific fruits, such as pears, apples, strawberries, and watermelon. However, Brazil nuts, sunflower seeds, and oats may also be beneficial. To reduce more than half of the potassium in your produce, wash chopped fruits and vegetables in cold water. Chopping it will increase the exposed surface area for rinsing. Western diets are typically low in fiber. Switching to a whole food diet rich in plants can boost fiber intake and protect kidney health. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 5. Limit salt intake. Your doctor has probably asked about your salt intake because eating too much salt may lead to high creatinine levels. While sodium, an element of salt, is necessary for healthy bodily functions, most Americans consume excessive amounts. Most of the sodium in the American diet comes from processed foods and restaurant meals rather than natural sources or salt added to home-cooked meals. According to a 2020 study published in the International Journal of Molecular Sciences, people in early to severe stages of CKD can benefit from a low-sodium diet. In the early stages, the diet lowered proteinuria, or protein in urine, and intensified the effectiveness of blood pressure medications. In the later stages, with reduced kidney function, the salt-restricted diet helped prevent fluid overload and reduced the quantity of dialysis sessions needed. Excess salt increases the body's fluid and blood pressure. The high pressure and excess fluid within the kidneys cause its blood vessels to narrow. The force of blood flow on narrowed vessels damages them and limits the blood flowing through the filtration system. Waste, including creatinine, may build up in the body due to inadequate filtration, causing creatinine levels to rise over time. Limiting salt intake is vital for people who are on dialysis to prevent high blood pressure and heart enlargement. The reason for this is that dialysis machines may not fully balance excess salt in the body. Following a low-sodium diet may lead to better management and outcomes for people with kidney disease. For individuals aged 14 and older, without health concerns, the DGA recommends limiting sodium intake to 200-300 mg per day, which equals 1 teaspoon of table salt. Patients with kidney disease should eat less than 500 mg daily, or just under 3/4 of a teaspoon of table salt. A diet consisting mainly of whole foods will typically reduce your overall salt intake. Foods high in sodium tend to be processed, packaged, canned, or cooked in restaurants. Create a habit of eating low-sodium whole foods and reading food labels. Avoid packaged foods with more than 400 mg of salt per serving, which can be challenging. Also, use less salt when seasoning your food, and remember that sea salt and regular salt have equal sodium content. Lastly, try using herbs and spices to flavor your meals instead of salt. 4. Exercise regularly, but avoid overexertion. People with kidney disease typically have low levels of physical activity. However, a regular exercise program has been shown to improve creatinine levels and GFR. Exercise supports kidney function by reducing inflammation and slowing tissue damage caused by waste product buildup. Besides that, it may also help increase blood flow to the kidney's small blood vessels and tubules. Many studies show the benefits of appropriate exercise in patients with kidney disease. A study published in 2022 reviewed previous research to determine exercise guidelines for individuals with kidney disease. The researchers found that people who regularly did safe aerobic and strength training over 6 months achieved the most benefits and improvement. An exercise training program should be tailored to your fitness level, considering your breathing, heart rate, and sweating response. It's best to start your exercise routine with a low-intensity activity. This can include walking, swimming, or lifting light weights with many repetitions. Once your body becomes comfortable with the activity, you can slowly increase it by varying the frequency, length, and intensity of your exercise. Gradually, you might even work your way up to high-intensity exercises like running, mountain biking, vigorous dancing, or strength training with heavier weights. Try breaking up your exercise sessions throughout the week to achieve the best results. Make sure you stay hydrated and prevent yourself from overheating, especially in hot environments. This can help prevent overexertion, which could lead to kidney complications. Also, patients with kidney disease, diabetes, or heart disease should let their bodies adjust to exercise before adding intensity. If you experience lightheadedness, chest tightness, pain, or can't catch your breath while exercising, stop your activity immediately and consult your health practitioner before resuming. Adding regular exercise to your treatment plan can keep you healthy and help manage your chronic kidney disease, or CKD for short. 3. Stop smoking. The effects of smoking on kidney health are well known. Kidney disease worsens faster in people who smoke and have a GFR of less than 45 milliliters per minute. Chemicals found in cigarette smoke, such as nicotine, can narrow the kidney's tiny blood vessels. In addition, smoking long-term can eventually cause conditions such as atherosclerosis and renal artery stenosis. These conditions result in a hardening of the blood vessel walls due to fatty deposits called plaques, which reduce blood flow to the kidneys, raise blood pressure, and damage the kidney's filtration system. The Journal of Multidisciplinary Healthcare published a small-scale study in 2022 that examined the effects of smoking on people who were otherwise healthy. The findings revealed that increased smoking was linked to higher creatinine levels. The good news is that quitting smoking may lower your creatinine levels. The longer you refrain from smoking, the lower your risk for further kidney damage. However, smoking can be a difficult habit to stop. Luckily, there are many tools out there to help you quit smoking. Ask your doctor for resources such as counseling, medications, or nicotine gum. Gather support from loved ones and pick a quit date. Be prepared for challenges. Changing habits like going to smoke-free places or spending time with friends who don't smoke may make quitting easier. You might need to find ways to cope with difficult emotions, like using relaxation methods, such as deep breathing and meditation. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 2. Get high-quality sleep. People with CKD commonly have sleep disturbances. Common reasons include uncomfortable nighttime leg twitching, called restless leg syndrome, mental health conditions, sleep apnea, and medication side effects. Additionally, people with severe CKD may have problems sleeping due to a buildup of toxins and chemical imbalances caused by poor kidney function. Patients undergoing regular dialysis may sleep during sessions, which causes an imbalanced sleep-wake cycle. Getting regular, high-quality sleep lasting between 6 and 8 hours can lower creatinine levels and prevent the progress of kidney damage. High-quality sleep is associated with fewer sleep disturbances, like difficulty falling asleep or staying asleep. While the mechanism is not fully understood, appropriate sleep reduces risk factors for kidney disease such as diabetes, obesity, and high blood pressure. It can also trigger the body's fight or flight response and inflammation, causing damage to the kidney's filtration system. Getting good quality sleep may also be preventive. A 2019 study in the Journal of Clinical Sleep Medicine found that over an 8-year period, people with sleep disturbances or poor quality of sleep, those who slept less than 4 hours, or those who took sleep aid medication, had an increased risk of developing chronic kidney disease. By focusing on sleep quality and quantity, people may be able to prevent worsening kidney damage. Early recognition of poor quality sleep is essential and should be addressed to prevent worsening kidney function. Treatments include taking medications to prevent or decrease restless legs, using cognitive behavioral therapy to help with falling or staying asleep, and removing enough fluid during dialysis to improve sleep apnea. 1. Eat more plants. Following a mostly plant-based diet will also help you improve your kidney function and lower your creatinine levels. These are safe for people with CKD and additionally improve GFR and delay the need for dialysis. Eating primarily plant-based foods also provides better management of unhealthy cholesterol, weight, blood sugar, and blood pressure levels. These benefits prevent or reduce kidney complications associated with cardiovascular disease, high blood pressure, and diabetes. The American Journal of Kidney Diseases published a study in 2023 that assessed the effects of following a plant-based diet over 5 years in people with different stages of CKD. In fact, the researchers found that people who consumed more meat and processed foods like white flour and rice, and sugary foods and drinks, had lower life expectancy and worse CKD outcomes. Consuming more plants and less meat and processed foods is beneficial for those with kidney disease, even more so when the disease is in its early stages. When you develop a habit of eating a whole food, plant-based diet, you eat mostly fruits, vegetables, and whole grains suitable for people with CKD. You'll also eat legumes, seeds, nuts, herbs, and spices. Lastly, you'll avoid or limit the consumption of meat, dairy, and processed food. Including more plants in your diet increases your antioxidant levels, which reduce kidney tissue damage, and phytates, which lower blood phosphorus levels. Phosphorus, usually found in dairy products, is harmful to the bones and blood vessels in people with CKD. Eating less meat reduces the amount of protein in the blood, which results in lower acid levels. When acid levels are too high, known as metabolic acidosis, the kidneys have to work harder to maintain the right acid-base balance. Metabolic acidosis leads to the kidney's filtration system damage, inflammation, muscle wasting, and bone breakdown. By avoiding processed foods, you can limit the harmful effects of high salt, sugar, unhealthy oil, and artificial food additives. In this section, we discussed key habit changes you can make to help lower your creatinine levels, exercising regularly and preventing overexertion, eating more fiber and a plant-rich diet, and limiting salt intake. Others include avoiding over-the-counter anti-inflammatories, improving sleep, and stopping smoking. Next, we will discuss when to see a specialist, additional testing that may be needed, and treatment options. Getting to the diagnosis. When muscle cells break down, a protein byproduct called creatinine circulates in the bloodstream. The kidneys eventually filter out creatinine from the blood, which then leaves the body through urine. Creatinine testing assesses kidney function by measuring levels in both urine and blood. Doctors monitor creatinine to identify kidney damage early or worsening of existing damage. Increasing levels may indicate a slowing kidney filtration rate, known as the glomerular filtration rate. There are many reasons for high creatinine levels. Some aren't the result of kidney damage. These may include muscle breakdown from high-intensity exercise or muscle wasting. Other potential causes include pregnancy, poor hydration, dietary protein in cooked meats, and bodybuilding supplements. Kidney-related factors leading to increased creatinine levels might be infections, certain medications or blockages caused by kidney stones, tumors or injuries that can obstruct urine flow. Health conditions, such as diabetes, elevated blood pressure, congestive heart failure, and excess weight, also increase your risk for kidney damage. If you have high creatinine levels, treating the underlying cause as soon as possible may stop or slow down kidney damage. You may need to see a nephrologist, a medical doctor specializing in kidney or kidney-related conditions. Involving a nephrologist in your care can also be helpful if you have conditions like high blood pressure or diabetes, which can cause kidney damage. After learning about your medical history and performing a physical exam, your nephrologist will order lab tests to help determine the cause of your high creatinine. These tests may include blood sampling to check your blood cell count, blood urea nitrogen, or BUN, GFR, or cystatin C. They will also want to check urine tests, such as a urinalysis, protein to creatinine ratio, albumin to creatinine ratio, or creatinine clearance. Sometimes, saliva sampling can be helpful for genetic testing to rule out any genetic link disorder that may impact your kidneys. Imaging studies help visualize the kidneys. These tests may include ultrasound, X-rays, computed tomography, or CT, and magnetic resonance imaging or MRI. Your doctor might request a biopsy in which they obtain a sample of kidney tissue to diagnose a suspected or unknown condition. Treatment. Once the cause of your high creatinine is determined, various treatment options may be available. For people with high blood pressure, diabetes, or heart failure, managing these conditions can help preserve kidney function. Lifestyle changes that may be beneficial include taking medications, such as antidepressants. For more information, visit www.fema.gov. Adding or excluding types of foods, improving sleep, lowering stress levels, exercising, and managing weight. Rates of CKD are steadily climbing and may be preventable with daily habit changes. According to a 2023 review published in Kidney Medicine, lifestyle changes may affect creatinine levels and directly or indirectly affect kidney health. Several conclusions from the meta-analysis were: exercise made the most significant impact on improving creatinine levels. Dietary interventions helped control blood pressure and reduce protein leakage into the urine. The combination of weight loss plus blood pressure management may positively impact kidney health. There was an overall improvement in quality of life. People who make positive changes may have better kidney health outcomes, although it remains unclear which lifestyle changes and their combinations lead to the best results. CKD is usually not reversible in later stages. Depending on the severity of CKD, some people may need long-term dialysis. A dialysis machine filters waste and excess fluid from the blood, replicating what your kidneys would normally do. This can be done at home through peritoneal dialysis, nightly, or in a clinic a few times a week with hemodialysis. Patients on long-term dialysis might be considered for a kidney transplant. Monitoring your health status is essential. Treating health conditions related to kidney damage, such as high blood pressure, low red blood cells, and diabetes, helps prevent complications in other parts of your body. You have learned several fundamental facts about creatinine and its relation to kidney function. Creatinine levels can be early indicators of kidney damage and are used to monitor the progression of kidney disease. Levels may rise when the kidneys can't filter the blood and remove waste properly. Factors linked to increasing creatinine include health conditions, such as high blood pressure, diabetes, and excess weight. It's never too late to start making small daily lifestyle changes to help lower high creatinine levels because they might significantly benefit your kidney function and overall health. While chronic kidney disease may not be reversible, implementing these 7 beneficial habits can prevent the worsening of your condition and improve your quality of life. We hope you enjoyed this video about 7 daily habits that can help lower your creatinine levels. Watch more of Health Today's content to learn about trending health topics. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here, we share the worst 22 foods that can ruin your effort to lower creatinine and prevent kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed. Stay healthy. 10 foods that naturally detox and cleanse your kidneys. The kidneys play a vital role in filtering waste and toxins from our bodies. Maintaining healthy kidneys is essential for overall well-being, and one effective way to support their function is through detoxification. While there are many kidney cleanse programs and supplements on the market, nature provides us with a variety of foods that can naturally aid in kidney detoxification. Let's explore 10 such foods that can contribute to healthier kidneys. Ginger, known for its warm, spicy flavor, is a versatile and ancient spice celebrated for its medicinal properties. This root has several benefits for overall health, including support for kidney health and detoxification. Ginger's active compound, gingerol, acts as a potent anti-inflammatory and antioxidant, helping to protect the kidneys from damage and reduce inflammation. It also aids in promoting healthy blood circulation and supporting the body's natural detoxification processes, whether used in teas, soups, or incorporated into various dishes. Ginger offers a flavorful way to nurture your kidneys and boost your well-being with its natural healing properties. 2. Cranberries. Cranberries are a potent natural remedy for supporting kidney health and detoxification. Packed with antioxidants and phytonutrients, these small red berries help prevent urinary tract infections, UTIs, by inhibiting harmful bacteria from adhering to the urinary tract walls. This not only aids in flushing out toxins, but also reduces the risk of kidney infections. Cranberries' detoxifying properties support the kidneys in efficiently filtering waste and maintaining their vital functions. Whether consumed fresh as juice or in supplement form, incorporating cranberries into your diet can be a delicious way to boost kidney health and promote overall well-being. Lemon. Lemons are a citrus powerhouse, with remarkable benefits for kidney health and natural detoxification. High in citric acid, lemons play a crucial role in dissolving kidney stones and preventing their formation. By enhancing urine production, lemons help flush out toxins and impurities, lightening the burden on the kidneys. Additionally, their potent antioxidant content combats oxidation, promoting a healthier kidney environment. Enjoying warm lemon water in the morning can kickstart your day while providing your kidneys with a refreshing cleanse. Embrace lemons in various culinary creations to harness their cleansing effects and support your kidneys' vital functions. For apples. Apples are not only a delicious and popular fruit, but also offer significant benefits for kidney health and detoxification, packed with pectin, a soluble fiber. Apples act as a natural detoxifier, aiding in the removal of heavy metals and toxins from the body. This gentle cleansing effect can help support the kidneys in filtering waste efficiently. Additionally, apples are rich in essential vitamins, minerals, and antioxidants, contributing to overall kidney function. Whether eaten raw or consumed as apple juice, these nutrient-dense fruits make a delightful addition to your diet, promoting kidney health and supporting your body's natural detoxification processes. 5. Berries. Berries, including blueberries, strawberries, and raspberries, are a vibrant and nutritious group of fruits known for their exceptional health benefits, especially for kidney health and detoxification. Packed with powerful antioxidants such as anthocyanins and flavonoids, these berries help protect the kidneys from oxidative damage caused by free radicals. Their anti-inflammatory properties also aid in reducing kidney inflammation and maintaining optimal kidney function. Additionally, the phytochemicals in berries support the body's natural detoxification processes, assisting the kidneys in eliminating waste and toxins. Including these colorful delights in your diet can promote kidney health while indulging your taste buds with a burst of natural sweetness. 6. Garlic. Garlic, with its pungent aroma and distinctive flavor, is more than just a culinary delight. It also offers numerous health benefits, including support for kidney health and detoxification. Rich in sulfur compounds like allicin, garlic acts as a potent antioxidant and anti-inflammatory agent, protecting the kidneys from oxidative stress and inflammation. These sulfur compounds aid in the detoxification process, helping to eliminate toxins and waste from the body. By incorporating garlic into your meals, you not only enhance the taste of your dishes, but also provide your kidneys with a natural boost, promoting overall kidney function and contributing to a healthier, toxin-free body. 7. Turmeric. Turmeric, the golden spice renowned for its vibrant color and earthy flavor, is a true powerhouse for kidney health and detoxification. The active compound in turmeric, curcumin, and sage boasts potent anti-inflammatory and antioxidant properties that support kidney function by reducing inflammation and protecting against oxidative stress. Turmeric's natural detoxifying abilities aid in flushing out toxins and impurities from the body, easing the burden on the kidneys. Whether used in cooking, as a spice in various dishes, or consumed as a supplement, incorporating turmeric into your daily routine can be a flavorful way to nurture your kidneys and promote overall well-being. 8. Leafy greens. Leafy greens, such as spinach, kale and Swiss chard, are nutritional powerhouses that offer exceptional benefits for kidney health and natural detoxification. These verdant wonders are rich in essential vitamins, minerals, and antioxidants, including chlorophyll, which supports kidney cleansing and detoxification processes. The high nutrient density of leafy greens helps maintain optimal health function, while their low potassium content is beneficial for individuals with kidney issues. Whether enjoyed raw in salads, blended into nutritious smoothies, or lightly cooked as a side dish, incorporating leafy greens into your diet nourishes your kidneys and contributes to a healthier, toxin-free body. 9. Beets. Beets, with their vibrant hue and earthy flavor, beets are not only a delightful addition to meals, but also offer remarkable benefits for kidney health and detoxification. Rich in betaine, a natural compound, beets support both liver and kidney function, aiding in the elimination of waste and toxins from the body. Furthermore, beets improve blood flow to the kidneys, promoting their overall health. These root vegetables are also low in potassium, making them a suitable choice for individuals with kidney issues. Whether roasted, boiled, or enjoyed as a refreshing juice, incorporating beets into your diet can be a delicious way to nurture your kidneys and promote overall well-being. 10. Watermelon. Watermelon, with its juicy and refreshing taste, not only quenches thirst on hot days, but also provides significant benefits for kidney health and natural detoxification. With its high water content, watermelon helps maintain optimal hydration, supporting the kidneys in flushing out toxins and waste products efficiently. Additionally, this delightful fruit is a good source of potassium, which aids in regulating blood pressure and kidney function. Watermelon's natural diuretic properties promote urine production, further contributing to kidney health and the elimination of toxins. Whether enjoyed as slices blended into a refreshing juice or added to fruit salads, watermelon is a hydrating and kidney-friendly delight.